Hi, Samantha. How are you doing today?
Good, how are you?
Good, thanks. Thank you for taking some time to talk to everybody, really, about a rather interesting procedure you had done a couple
Yes.
years ago. And I just wanted to hear from you, and I think everybody would love to hear from you as to how did it go, where did we start, where are we now, okay?
Okay.
So let's start with how did this whole thing begin?
Well, it began with me waking up in the morning in excruciating pain because I clenched so hard, I'm assuming it was from stress, that my jaw locked and I couldn't open up my jaw. Once I pried my jaw open, it was like I got hit in the head with a hammer. The pain was in my entire face, my head. I couldn't figure out where the pain was coming from. You actually warned me that this was going to happen. I was like a ticking time bomb, and I exploded that morning. And called your office at 6 o'clock in the morning in tears, and you guys got me in first thing in the morning. Because you knew why, huh?
Yes, exactly. It's hard to believe sometimes when years and years go by and it's just there's no answer to this. There's no answer to it. It's hard sometimes to just
the answer was always a night guard.
Right.
But I broke 2 of them.
Right,
but,
exactly.
So they just assumed I was grinding, but it was it was the clenching.
Right. Right, exactly. Good. So, and then I know that day you came and I pretty much gave you my idea of like, hey, here's a method of how let's try and help you this way. Yeah.
Well, you pretty much told me that was my last option.
Yeah.
Because there was nothing else I could do.
No, unfortunately not. Yes.
It was really the last thing I could try.
Right. So, treatment was, hey, let's put some Botox right into the muscle. Let's get the muscle relaxed and see how your body reacts to it.
Yes.
Good. So we went ahead and did that. And how did you feel about that?
Best thing I ever could have done.
Okay.
It was, and I hate to use the word immediate because realistically that doesn't really exist, but it was almost immediate. So the pain that I was in when I came in here, you gave me the injections, and the only thing that I felt, of course, I think that you did help numb me too because of the pain that I was in.
Yes.
But by the time that wore off, the only thing that I was just sore.
Yes.
But the pain was gone.
Right.
And the pain was gone. You told me it was probably going to take about a week.
Yes.
It was 2 days. I was absolutely pain-free.
Wow.
And the soreness was actually going away. And so it was, and for the amount of pain that I was in.
Right.
That was amazing.
Right.
I was like, oh my gosh.
Right.
Yes.
Right. Excellent.
So it was awesome.
Perfect. Now, you still wear a guard?
Yes.
You haven't broken any?
Have not.
Good.
Yes.
Haven't any broken teeth?
Not since my Botox.
Yes.
Yes.
That's right. Now we've done 3 treatments?
3.
Perfect.
Yes.
Now, how do you know when you need your next treatment?
Because you can feel it.
Okay.
Because once you go through that amount of pain and then you go so long without having the pain or the tiredness or just, where you could just feel your jaw was stressed all night.
Right.
When you start feeling that come back, it comes back gradually.
Right.
So you first kind of start feeling that tiredness in your jaw.
Right.
And then that might, it could be just that you had a stressful day.
Right.
But then when an ache starts coming,
right,
you know that you're starting to clench. It's going away.
Right.
And then my first experience of having a little bit of pain again is when I call you because I know what it is.
Right.
But it does. It comes on gradually. You can feel the Botox, slowly wearing down. But now my experience is I've come 3 times, and it's immediate. It just automatically, if you catch it in time, then you will prevent yourself from going through all that trauma.
Right.
Which is a lot of trauma.
Yeah, for sure.
Yeah.
Well, excellent. That's really, that's just what I wanted to communicate with my patients as well. To just, kind of share your experience and that, there is something that can be done, right?
Yes.
And that, it's, nobody wants to get a shot. I totally get that. But, to you, what would you say that it's a fair trade?
Well, I would say that don't wait as long as I did because, the first one, it hurt because my jaw was so messed up.
Exactly.
But after that first one, I still would stress out about coming in and
Right,
getting it,
right,
and then
right,
you
right.
do it, and I'm going, oh, this is because I'm not hurting.
Right.
So
Exactly.
if you don't wait so long like me,
Yeah.
then it probably won't even hurt as bad because
Right.
they don't hurt anymore. The injections do
Right.
not really,
Exactly.
not like they did.
Not like they did. Yes. Perfect. Well, thank you very much for sharing your information. I know it's going to be helpful for a lot of folks.
Oh, I hope so, because it definitely huge difference for me.
Perfect. Thank you very much.
You're welcome.